right, I'm excited to have everybody back. This is the 12 o'clock show with Mayor Joe, and this week's special guest from the Franklin County Department of Health and longtime participant in the show, Joe Mazolla. Thank you for coming today.
Thank you, Mayor. Appreciate the invitation. Great to be back.
Yeah, it's thankfully there's no pandemic that we're really talking about right now, so it's just some of the other stuff. But I appreciate you coming in because we know that it is the beginning of school and everybody's started, which means at this point in time everybody's sick. But before we dive too deep, I just want to, again, today is obviously the anniversary of 9/11. You know, for those of us that remember where we were and what we watched that day, it's never going to leave our minds. You know, I had the privilege of teaching about it a number of years, and I went from teaching kids that saw it on TV, that saw it happen, all the way to the point of people that were not alive when it actually happened. And it was as ancient to them as Pearl Harbor would be to us. But at the same time, you know, we had a great ceremony this morning recognizing the sacrifice the police and firefighters made to try and save as many lives as we can. And I always look at it as tragic as that was in the days and the weeks that followed, that it was one of the few times where I felt that everybody kind of came together as a nation. And while tragic circumstances shouldn't be the only reason that that happens, it was nice and refreshing to see that. So hopefully we can all learn a lesson from that moving on. But for you, I guess my big question is now that you know COVID is obviously still here, but what trends are you seeing from the Department of Health, and how are you dealing with these new and different things?
Sure. Well, first of all, again, thank you for the invitation. It's great to be here in Reynoldsburg. And as you mentioned, you know, particularly today, very solemn day, and really a day to reflect as a community. But and I am old enough, obviously, to remember September 11th and remember exactly where I was that morning. And you know, I have children who don't know, didn't experience that, but do ask a lot of questions about September 11th. And so I, you know, definitely appreciate, you know, as an educator, but as a community, you know, we continue to remember, and that's what we need to do. You know, September 11th really was the reason for a lot of the emergency preparedness activities that we do as a nation, obviously, and here in public health, and a lot of the work that we do actually was as a result of the terrorist attacks that day. And certainly in the last 23 years, you know, we've been looking at ways to prepare for emergencies, all kinds of emergencies, and September is Emergency Preparedness Month. But to your question, you know, September is a very busy month in public health. As you mentioned, back to school. We really want to stress our back to school vaccinations, so making sure our kids are up to date on their vaccinations, and offer, of course, starting to offer seasonal influenza and now updated COVID-19 vaccines as well. We have seen, as you have probably seen in the news, a very steady increase in COVID-19 over the course of the summer. And so we really want to continue to stress to our community that COVID-19 is still here and will be here. We want to make sure folks stay up to date on their vaccinations, stay home when they're sick, wash their hands, all those things that we've been talking about for so long now. But the fact of the matter is that respiratory season is here, and we want to make sure that we stay ahead of that and make sure that we proactively provide opportunities for those vaccine clinics in our community. And so respiratory season, back to school, but we're also looking at some other data across Franklin County, and I want to maybe we can talk a bit about some resources on our website for folks to be able to look to see kind of how we're trending in for different public health topics. But it's always you know, busy in public health, but we appreciate the continued collaboration with the city of Reynoldsburg.
No, it's been good. I wish we met under better circumstances the first time around, but I think that partnership is good. I know when you talk about schools and the involvement of that and how that happens, and everybody talks about the things to do to prevent, I still am shocked that we have to include hand washing as one of those kind of reminders, but it's incredibly important in that process of it. So kind of looking forward, obviously, you know, you said COVID is kind of on the rise. Is there anything that you guys are expecting or hearing about what our flu season / COVID thing, is there anything out there that you're looking at that is kind of saying, hey, this might be an issue moving forward?
So right now we're not looking at anything out of the ordinary. I think what we're planning for is certainly a very typical flu season. But really the things that we can control are obviously a couple things like we just talked about. And I think first and foremost is making sure that folks are getting their flu vaccine. You know, we've seen Unfortunately, sort of a steady decline in individuals getting their flu shots. So we really want to stress the importance of staying up to date and getting that seasonal flu shot. And right now is a great time to do that. Don't wait until January or February. Flu season is starting, and it's going to go all the way through May. And so we really want to encourage individuals to get that flu shot early, and really take that opportunity to protect yourself and your family. And so, we will certainly be tracking and monitoring our flu surveillance on our website, and so folks can sort of stay up to date with respect to how that's impacting Franklin County. But right now, it's really about that awareness and that being proactive and taking those steps to not only get your vaccine, but also, again, if you're not feeling well, to stay home. It's really something we really want to continue to stress. We don't want folks to make things worse for their family, for their coworkers, for their schools, and we want to make sure we continue to stress that as well.
No, I agree. I mean, you're absolutely right. I know we have a flu shot clinic coming up for the city staff in the next couple of weeks, because we want to participate in that as best we can. I always kind of look at it when people talk about, oh, I never get the flu, or this, that, and the other. I'm like, it's not necessarily just about you. It is about the idea of those in your network. Those are your friends and families. Maybe there's people out there that have, immunocompromisation disease, something along those lines that maybe make them more susceptible to severity of flu. And for the most part, when I've gotten the flu shot, outside of the initial shot itself, I rarely notice anything, and if I do, maybe I just feel a little tired for 24 hours and then I'm fine. But at the same time, in my job and even when I was teaching, being tired was a normal thing, so I probably didn't really notice anything out of it. But definitely something that's there. You mentioned clinics, so I didn't know, do you have any clinics that are coming up for people who, obviously aren't working for the city of Reynoldsburg for ours, but do you have any clinics coming up in the not too distant future?
We do. We have clinics at the health department at Memorial Hall.
Okay.
So folks can go to our website, myfcph.org, and click on the information there to make an appointment. We do take walk-ins as well, but appointments are preferred. But certainly, we want to make sure that clinics are available and accessible to the community. So we'll be looking at opportunities to do some additional clinics here, and as we get into the fall, and really make sure that we're promoting other opportunities as well. So whether it's at the health department, at your local pharmacy, your healthcare provider, other opportunities, maybe school districts are hosting that as well. Thank you for hosting yours here at the City Hall. So a lot of employers are really being proactive and really trying to reduce those barriers to make it very easy to get your flu shot and stay up to date, and flu and COVID-19. Yeah. I do want to maybe go back to your first question as far as some trends here that we're seeing. And one of the things I wanted to mention is that we're starting to see an uptick in pertussis, whooping cough.
Okay.
And so we're going to be putting out an advisory about that probably today or tomorrow. And so I just want to maybe just call attention to that. And again, when we talk about vaccine preventable disease, that's one of them, and we really want to stress the importance of staying up to date on vaccines. But we are starting to see a little bit of an uptick, and this is something that we're seeing not only here in Franklin County, but in Central Ohio. So,
well, I would imagine that a lot of that is due to fallout from concerns about vaccines that have been brought up, say, in the last 5 years or so, and people wanting to or not wanting to. I remember growing up that was just, you had your standard list of whatever it is that you were going through and that type of thing. So, yeah. Are we good?
Yep.
That's
Someone asked if we can turn it up, so hopefully they can hear better.
No, that's fine. So I guess a couple of things. What are some other services offered by the county health department that you think would be good? I know you've got an example here. It's always good when you get to bring some things to look at. So.
I do. I've got several props here this afternoon. So as I mentioned, September is Emergency Preparedness Month for us here in public health. And what I brought here today was a Stop the Bleed kit. I should look at the camera.
Go ahead.
So right here is a Stop the Bleed kit. So at Franklin County Public Health, we provide Stop the Bleed trainings to organizations and community members. So in the case of an emergency, where someone, whether it's a car accident or unfortunate violence and other activities, if you are in a situation where someone needs immediate medical attention, and obviously call 911 first, but as you're waiting for our first responders to get there, if you have a Stop the Bleed kit, you can help someone from bleeding out, and it only takes a few minutes, unfortunately, in some cases. So these have literally saved lives in the community, and so we want to really take an opportunity to promote these as a great resource to keep in your car, in your workplace, at your home, wherever you might be. And I want to thank the Franklin County Board of Commissioners who provided us American Rescue Plan dollars to purchase these and to offer these trainings in the community. So this is a great resource and available at the health department. So just let us know how we can maybe provide that to city employees and certainly to other members of the community.
Well, it's funny you mentioned that because one of our residents, and I believe it was in last week's show, they actually asked specifically about that. We talked about AEDs as well, but specifically this one. And I had not heard the combination of words, the stop the bleed. So obviously I know stop the bleeding, but to have that kind of thing here, this was not planned. This was just kind of a happy accident in this regard. So hopefully he's watching, but that's definitely something that would be great.
Yeah, so, things like this, AEDs, the lock zone availability, stop the bleed kits. I mean, we're trying to make sure we have resources in place in the event of an emergency or some medical situation. So
yeah,
these are great.
Nobody's planning on it. I mean,
nobody plans for that.
But that's part of the issue. I actually had a former student of mine that came into City Hall, and this was a student from a long time ago. He had spent some time in Iraq, and he was injured severely. But some of the techniques that had been used at that point in time have made it into something like this because of the severity of the wounds that you see and how quickly to react. And he was safe, his life was safe because the sergeant knew exactly what to do. So it's just how that all kind of works in. Any questions from our audience so far?
We do have a couple. First question is about water drought condition and the effect on water quality, increasing the mosquito spraying, and what to do with tires that are stored outside and pools that are not chlorinated or covered.
Those are all sorts of. All right, so let's start with the first one. Let's go back to the very first one.
So water drought conditions affecting the effect that has on water quality.
So I know Franklin County has not been included in that drought restriction area, but I do know that other counties surrounding Licking, Fairfield, things like that have been. Do you have anything else specifically from that you're aware of?
Nothing specific to Franklin County Public Health. Definitely appreciate the question, and certainly from an environmental standpoint, the conditions that we continue to see from climate change, we see it's going to continue to impact our health in various ways. But from a water quality standpoint, no, we haven't heard any concerns in Franklin County.
No, I know that the city of Columbus, there was an article just recently talking about how they're going into kind of their reserves, just a little bit into it, which is where the city of Reynoldsburg gets their water, so all of that chlorination, there haven't been any issues with that. I think the biggest thing that we have seen, obviously, is, to be blunt, it's our soccer fields. Usually at some point in time in June, July, and August, there's a little bit of rain, but when there's not, our grass fields are not always still grass. There's a lot more crunchiness all the way across, and so that's not always the most fun to play on, but I think that's really the big thing from there. What was the next one?
Increasing on mosquito spraying and what to do about tires that are stored outside in pools that are not chlorinated or covered.
All right, so I'll start with the first one as far as the mosquito spraying. Correct me if I'm wrong, usually there's traps out there, and if they detect West Nile, that's usually when the first spraying goes. And I know Reynoldsburg has had a number of sprayings on both Licking and Franklin County side in the last little bit. Isn't that usually the way it is? You have to have that kind of positive test for West Nile first before they go out and spray.
That's exactly right. Exactly right. So we want to be very intentional in terms of our mosquito management program, and we do have a lot of ways that we can monitor that. And so when we do see West Nile virus within the mosquito population, we of course then would reach out to the local jurisdiction, in this case Reynoldsburg, and then we would be very intentional about how we take those next steps. So and we likely will see that continue into probably early October, again because of very warm today.
Yeah.
So we're gonna mosquito season will continue for the next several weeks.
I'm trying to think. Usually when we get notified, you're looking at most 48 hours between the time that we get notification before they're spraying. We have enough time to get it out and put the information so people are aware of it.
Correct.
But for the most part, like I said, it's relatively contained to a specific area, and we get those notifications out. As for the tires thing, they shouldn't be around as far as the tires. So if you are seeing that in your communities, please let us know, whether it's give us a call to code enforcement or reach out on the Reynoldsburg Engage app, because those are little pools of everything that you don't want in a community, let alone the aesthetic issues with that. As far as pools and things of that nature, I think most everybody's probably emptying their pools, and so I don't know what that would be. If I'm thinking, is this like on a backyard pool type of thing, or something along those lines? I would think that would probably be, most of those would be cleared out with it. So if there's clarifying questions afterwards, please let us know. Was there anything else?
Yes, there's a few.
Hey, you're popular.
great.
You get a lot of questions.
That's great.
All
That's why
right.
I'm here.
Second is the information from the flooding study available online, and if so, where is it located? Also, are there any preliminary ideas for what is to happen with the new 69-acre annexation, single-family homes, apartments, or a mix?
All right. So the first question is refresh my memory again. The first one was
About the flood study
flood set.
info
Yes, that,
available online.
that is available online. Go to our departments page. It'll be under engineering and projects, and that's where you'll see the slide deck from there. As you know, Reynoldsburg has had some flooding issues over the past few years, so we had a great town hall last week that we're now able to start developing a model based on where the rain is coming from and where areas are most vulnerable, whether it's certain intersections that just happen to kind of dip down and that floods in that area and other things, but that is on our website. And the annexation request that is there, yes, it is probably going to be a mix of housing. We haven't got anything official yet. We do know that MI will be building some homes up in that area, which is on the eastern portion of our boundary line. We're hoping to have that submission in the next day or two. So if we don't talk about it soon, it'll probably be, an update on next week's show. So, and that will be in Licking Heights schools.
All right, and they are wanting to know what is the effect of non-authorized immigration on healthcare, and what are those resources?
Honestly, this actually leads right into a comment with it. First of all, healthcare is healthcare, and if people are sick, they're going to get treated. That's it. We can have conversations about immigration policy until the cows come home. Obviously, municipalities don't have a lot of influence in that. This is something that I was going to bring up. So as some of you know, if you've been watching for a while, I'm a member of the Ohio Mayor's Alliance, which is made up of the 30 largest cities in the state of Ohio, and we meet on a regular basis. We actually met earlier this year, I believe in April, and we met in Columbus, and one of our legislators luncheon, and the different state representatives and state senators came in. Lieutenant Governor Houston came in, and the mayor of Springfield actually talked about this. This is not the first time that I have heard about all of these issues that are coming up. But I did want to mention that, when people come into a community, we aren't delineating and looking, say, okay, you're this, and therefore you get care, you're that, you don't get care. If people come into our community, they're going to get the care that is there. We can argue about resources until the cows come home. I think, and again, I'm not trying to put any pressure on you, but I'm sure that you would be much appreciative of additional state, county, federal funding for anything that you want in there, because no one ever gets enough. Same thing with cities. But we deal with those issues. That's what it is. When you have an immigration influx in, regardless of whether you believe they're legal or illegal status, there are going to be things that you need to get caught up on. Other countries don't have the same vaccination standards as we do. They don't have the same records management that we do. So when somebody comes in, you don't necessarily know what is and is not there. There's concerns about language barriers all the way around. Franklin County is probably more used to a lot of the languages than some other communities in Ohio. But there are some similarities to what people have talked about in Springfield compared to Reynoldsburg. Reynoldsburg is the home, in my opinion, of the probably largest Nepali community in Ohio. I know in central Ohio it is Reynoldsburg and a small area off of Tamarack Circle in 161 area, kind of where, not too far from where I used to teach. Reynoldsburg students, 1 out of every 7 is Nepali Bhutanese right now. So we're estimating based on census numbers, you're looking at probably about 10,000 Nepali community members that have come into our community over the last 5 to 10 years, which is not too far off the pace of some of the things that you may have seen in the media recently, specifically about Springfield with their Haitian population. But then it turned into something else. It turned into a cheap political attack based on rumor and innuendo, which is not at all different from some of the things that I've seen since I've been in office. We had gotten calls, especially early on in 2020, 2021, about what Nepali community members are alleged to have been doing and things of that nature. But I'll tell you what Nepali community members have done, in my opinion. They have embraced our community. They have walked in our 4th of July parades. They are entrepreneurial to all extent, whether it's local corner stores, restaurants, clothing stores, furniture stores. They are actually embracing all the things that are part of that American dream. And I welcome them here. And I think for the most part, all of Reynoldsburg does. If we continue to get more immigrants coming into our community that allows us to express our diversity, we will do as all we can to make sure that they get the resources they need to make them fully integrated into our community. And I do know, having talked with the mayor of Springfield and listened to him firsthand, face to face, he's not opposed to the Haitian immigrants that are coming there. He gets that. They've actually been a very big benefit in terms of their workforce. If you've seen an episode, some media came out on PBS about some of the workforce issues that the Haitian community solved. what he's looking for is, because it happened, the language issue was something that they had to deal with, the influx of students in schools, which in all honesty is no different than what Reynoldsburg, Whitehall, Columbus, Dublin, Gahanna, everybody's dealt with the same things. It just happened to be at a contained spot in this one. Because if you looked at the history of Haiti over the past 5 years, stability in government is not there. Violence is frequent, and there are a lot of limited options that are there. The United States could go in and imperialize and take over and do that type of thing, but nation building is not in the purview right now with this administration, or really any administration since Iraq and Afghanistan has wanted to do. And so at that point in time, if they are legally seeking asylum to live their lives, they're going to have the opportunities to come here. I know that you probably watched the address from Governor DeWine yesterday, and he talked about additional resources to Springfield to help them. Not necessarily getting into the politics of it all, but the reality is the people are there, and we're not going to turn them down. We're not going to deny them that opportunity, and I doubt that anybody even checks resident versus non-resident aspects of things. I know, for me, if somebody's bleeding and hurt, I'm helping them. I don't really care about the rest of it. So I hope that answers a little bit of it. Moving forward, continue to try and do what we can to make sure that all our community members get the resources that they need, because they're out there. And I think our biggest issue is letting people know that those resources are out there. It's not that they aren't. I think they are. They just need to get out there and get that out, get the word out more, which is why I'm glad you're here today.
Well, I appreciate that, and I think this is really well said. And watching the press conference yesterday with the governor and the director of health and other state agencies, really appreciate the support that the state's providing to the local community there, and particularly the health department, who I know
they're cheering them on inside.
I am cheering them on, and I think they're doing the right thing to take care of folks who are there, and I think that really needs to be acknowledged, and we certainly support them from here. And our community is diverse, and we welcome that, and we want to continue to embrace that. And as a health department, we're always looking for ways to make sure that we're engaging and serving the community.
Absolutely. Anything else for the director?
Yes. What is happening for bird flu? Recent genetic transfer.
That's a good question. Yeah, so there is really no news there. Let me be very clear, no news about that here in Ohio. The risk to avian flu is extremely low in this country, and particularly in this community. The information that the CDC has is up to date. I don't have that right in front of me, but I certainly can make that link available. We are in close communication with the state health department, and so as information is shared from CDC to ODH to the local health departments, we will, of course, will share that with the community. But there really is no new information with respect to bird flu or avian flu, and so we certainly hope that will continue.
Let's keep that. Yeah, we've already had our pandemic.
Yes.
We're good for another one.
Yes.
I think the last thing that I saw is that there's been one confirmed case of non-direct avian transmittal, but it was, those are, again, few and far between. But it's definitely, I think, because of what happened with COVID, I think that we're all a little bit more aware of those types of things. But that was a good question. And anytime you can talk about bird flu, it's a good thing. Now, you brought something here. Everyone is worthy of recovery. Can you tell us a little bit about this before we see if there are any other questions?
Absolutely. So September, in addition to Emergency Preparedness Month, is also Recovery Month. And so wanted to bring this and really acknowledge the work that we're doing here in the community to continue to advance the idea of recovery. So everyone is worthy of recovery, and I really want to stress that everyone is worthy. The disease of addiction certainly has impacted too many in our community, and so we want to continue to make sure that the message is that there are resources available to those who are struggling with the disease of addiction, and that recovery is not just one day; it's for a lifetime. And so, as a community, at Frederick County Public Health, we continue to make resources available for those, whether it's seeking treatment, harm reduction resources like naloxone, fentanyl test strips, things like that, and then of course prevention and education. And so we do all of that work through the Columbus and Frederick County Addiction Plan. But September being Recovery Month, really want to lift that up. And we have a great campaign called Recover for Life, which really kind of tries to break down these stigmas around addiction, and the fact that there are individuals who are struggling with the disease of addiction, and we continue obviously to lose individuals every day to overdoses in this community. It does not make the news like it used to, but the fact of the matter is we lose somebody at least every other day. And it's every single individual that we lose is a tragedy, and we want to continue to do everything we can to save lives in this community. We had several great events in August to honor and acknowledge International Overdose Awareness Day. The Franklin County Coroner, Dr. Nathan Overmeyer, hosted an event at the Franklin Park Conservatory where we heard from families who have lost family members to the disease of addiction. And so this issue continues to be of significant public health concern, and we want to continue to acknowledge that there are resources available. There are partners who are really engaged, again, through our Columbus and Franklin County Addiction Plan, and anything we can do to get information out to individuals and families in the community, we wanted to do that. So we've got this campaign, Recover for Life. It's on our website. I also brought with you, Mayor, for you a lapel pin. I have mine on here. And really just want to continue to find more opportunities to reach families who, again, who need those resources and who are seeking those resources. We hear too often that they didn't know where to turn. And so we want to continue to make sure that we do everything we can to get information to those who need it.
Well, one of the things that we do here is we do have our own recovery port that's administered by our city attorney, Chris Shook, and his amazing staff. And every so often, they get to do, in essence, a graduation party where somebody has made it through a particular program, and a recovery rate has been very successful. But when you say, it's not, you're not recovering. This is not like somebody having surgery and then recovering and going through. This is something that from the moment that you stop, the recovery never ends. It's a daily, hourly thing all the way across. And so again, appreciate your support in that. Appreciate obviously City Attorney Shook and his team for taking those types of things and applying it here locally at the local level, which is always a good thing.
Yeah, well, thank you for that. And what we have seen across this county is that whether it's through the courts, whether it's in schools, I mean, we're taking a very multifaceted approach to this, and it takes this continuum. So you're absolutely right. And I wanted to mention that if someone needs naloxone, they can order that right from our website, and we'll send it right to their home. And so there are resources out there. We want to make sure we continue to look for those opportunities. But we want to be a community of recovery, and so it takes all of the different organizations and really different partners from across our community to do that.
It's not easy, but it's definitely something a fight worth fighting for. Well, do you have a few minutes to stick around while I go through? I got a ton of other fun things to talk about. So.
Sure do. Can I just mention one more?
Oh,
one
please,
more thing?
yes.
I was asked to talk about this. So later this month, first to hear this, Mayor.
All right.
Later this month, we're going to come out with a podcast for the health department. Very excited about this.
There we go.
Do you have a podcast?
This is it.
This is the podcast,
Yeah,
right?
yep.
So we're coming out with our own podcast, and we're going to kind of launch that later this month. It's called Health is Real, and so we're excited about that. We're going to launch it with, I think, 3 episodes later this month, and one more way to kind of get information out to our community. So I guess this is your podcast. So I have not been on our podcast yet. I'm looking forward to the first episode that I will be on that. But I do want to just mention that again. Thank you for the invitation to be here.
Always, and we'll bring you back as often as we can. Hopefully, again, not during a pandemic. So we got a lot of different things, and if there's questions that come in, please just go ahead and give me a signal.
Yep.
Go for it.
Someone wants to know the web address for ordering the
naloxone?
Yes.
Sure. So they can go to our website, which is myfcph.org. So myfcph.org is our website. You'll see a button there to order naloxone, and certainly. If there's any questions about any other resources that are needed, please reach out to us.
All right. So as we all know, Reynoldsburg City Schools is going to be going to the ballot for a levy request. It's 6.65 mils, or that equates to $233 per $100,000 of value. This is going to be a ballot initiative. I think it's item issue 47 on the Franklin County ballot. I do not have the numbers on what they are in the Fairfield and Licking County side. But it's, as we all know, the last time Reynoldsburg passed a levy was in 2010, so they're kind of operating their budget on $2010 in 2024. So they've been able to not have to go to the ballot, but they're at that time where, because of the inequalities of state funding and the unconstitutional nature of everything, they have to do this all the time. So one of the things that always comes up is, well, people who live in apartments, they don't pay property taxes. And I say, yes, they don't actually write a very specific check from the individual. But the last couple of weeks I've been talking about various apartment complexes around the city and what overall they pay. So this one is actually our Redwood Apartments off Lancaster. They pay approximately $55,705 in property taxes, or that roughly equates to about $625 per actual unit in that complex. Not trying to dig too deep into the math, but the idea is that there is a ratio of square footage per, and that's what determines it. So last week, the one that was located on the Licking County side, that was, or I'm sorry, Slate Ridge, that was around $1,000 because their units were a little bit bigger. These are a little bit smaller, so that's there. But if you've got more specific questions, one, we've got a lot of community events. The first one coming up from here is September 25th at the Hamali Heritage. It is going to be live streamed from Councilman Buon Paccarel, a good friend of the show. He'll be on in a couple of weeks to talk about Diwali. We also have October 3rd, and this is kind of, talk about a long day. They're going to start off with a community conversation at Raider Nutrition, which is probably a good thing because they can get their energy drinks and protein drinks as they get ready for having another presentation later on in that morning at the Reynoldsburg Chamber of Commerce lunch. So there'll be a good opportunity there. I have a feeling they'll pop up a couple of other places too. I know they're working on some things. And then they'll be at the Reynoldsburg Senior Center from 11:30 to 12:30 on October 17th. If you don't want to wait that long, you can hop onto the website and pull up all that information. And most of the Licking, Franklin, and Fairfield County treasurer site or auditor sites are able to, you can put in and look at your address and see what you pay now, and then you can kind of get an estimated idea of what would be there. And I think they actually have that option on the Reynoldsburg website as well. You can always reach out to the board members themselves and answer questions. Now, this is one of the odd things that not a lot of people know. There are very, very strict rules for the Board of Education and the superintendent and treasurer on what they can and cannot say. So they passed a kind of more stringent law a few years ago where they have to be almost as neutral as possible. They can just do information purposes. They don't necessarily have the opportunity to say, hey, vote for the levy because of, whatever. So they can provide that factual information. There is a levy committee that's out there, and I know some of you have already probably seen it on social media. They're the ones that are going to be more of the cheerleaders of everything, talking about reasons why you should do it, as opposed to just the factual information. But either way, they'll be able to answer questions, or at least direct you and put you in the right contact with somebody who can answer those questions. So good luck with them. Well, we'll see how that goes. One other cool thing, and I don't know if you've ever had the opportunity to attend any kind of like Education Foundation galas. Reynoldsburg has one coming up. It's actually next Thursday night on the 19th. It's at one of our premier locations at 1883 Locale. Early bird pricing is $55 now, $60 at the door, or $60 the day of, and $75 at the door. But they do all sorts of cool things. They've got silent auctions. One of those silent auctions is the privilege of me smashing a shaving cream pie in my face. That's a big winner for a lot of people.
I've done that actually. Yep. We did a fundraiser, and that was the prize.
Yes.
I appreciate that.
It's a well bidded item, I'll say, all the way
across. I bet it is.
But they do all sorts of other things. They got some student art for sale as well, and then obviously the food is going to be catered by Hickory House, which is just down the road from here. So it's going to be a great time, and all the funding that comes in goes to one of two things. It's either going to go to teacher projects that are to enhance the educational lesson of the day. So maybe they need additional resources for materials and stuff like that, or also money is used for scholarship programs for those 8th graders to take their field trip to Washington, D.C. Those things are incredibly important, and again, we're talking about a big election this November, and talk about getting those kids into that environment where they can actually see the Constitution, the Declaration, they can start to see the congressional building, and all those things that kind of make our democracy work. It's a great opportunity, so hope everybody can do that. I know I'm looking forward to it. My wife is trying to decide, because she had some ankle surgery recently. She's trying to figure out what dress goes best with what tennis shoe, and tennis shoe is not what she wants to wear, but I think that's where her restriction is going to be. So, speaking of elections and all that, I'm going to go ahead and put this up there. These are yard signs filled in one of our disposal units. These are yard signs that have been collected and put in a container over the last 30 days. These are things that you've seen from people who are putting pressure, any number of businesses are out there. If you have a political yard sign or any yard sign and it's actually in your yard, you're fine. If you have something that's in what we consider the right of way, which for if you're in a house, it's between the sidewalk and the road, that they cannot go there, and they cannot go up into the open areas at intersections. That's actually part of what we're dealing with here. Probably we'll start seeing the political signs pop up in the next couple of weeks. Again, if it's in your yard, all for it. Outside of that, they may get collected. We don't have any local races outside of the levy this year, so I don't think that that's going to be an issue, but just want to kind of make sure everybody understands it. And just from a perspective of somebody who's run for office and has had yard signs and all of that, just leave them there. If you don't like what the issue is or the candidate or whatever, I get it. We all have our personal preference and things. Just don't take the sign. It's not worth it. It's a couple of bucks, and it's just one of those things where obviously somebody, if they really care that much, they're going to put another sign right back out there. It's just not worth dealing with. But we had that one. The other one I wanted to show you is kind of a before and after pic. I know this doesn't seem like a big deal, but you can see the dumpsters there. Dumpsters are supposed to have enclosures all the way around, and the reason why is because sometimes it's windy, sometimes it's rainy, sometimes animals, sometimes any number of different things. And so one particular business on the second page there, they actually went ahead and adjusted and put in those dumpster enclosures. So that way, if the trash is in there and it's in between pickup points, that trash is actually contained. I'm pretty sure that there's some health ramifications in there as well.
That's great. Yep.
So that way we don't have to worry about critters getting in and anything spreading from there. So that's a good thing that our code enforcement officers do, so kind of keep that in mind. Some cool things that we did at council. This was our council got back on Monday night from their month-long recess. We authorized the bonding for a new service building. So this is going to be in-house. We're dealing with this in-house, so we're not coming to the voters for anything. But we need a new service building. We have a parks and water facility in one location, and we have a street department in another. So we're actually going to combine everything on one site and get it to where we need it to be. So it's modern, it's safe, it's accessible all the way across. And so that was put up for legislation on Monday night. I'm very proud of the fact that one of our green initiatives, converting all the lighting at City Hall into LED lighting, we got a grant that's going to cover the complete cost of that. So we did that particular thing. And then the next one is traffic monitors. I'm sure no one speeds in your neighborhood, right? No one ever speeds anywhere. No. Everybody stops at red lights and stop signs and things. So in Reynoldsburg, that sometimes doesn't always happen. I don't know why it is. So we have actually we're going to be purchasing 9 dedicated traffic monitors that will collect data, and we're going to put them on the 9, I guess you could say, most complained streets in Reynoldsburg to start. I know there's more, we're going to get there, but this will help us collect some additional data, and then we'll help target enforcement to make sure people understand that no, you shouldn't be driving 80 miles in a 25-mile-an-hour zone. Don't know that we need to tell everybody that, but apparently we do. If you want to know more about all of this stuff, please join me tonight. I've been doing a walk and talk with the mayor series the last couple of weeks. I'm going to start tonight at 6:30 at Roundelay and Pryor, and what I'll do is I'll basically walk, and if you are in the neighborhood or anywhere in Reynoldsburg and you just want to have a conversation about anything that's going on, you can meet me there. Best case scenario is we had about a dozen people at one location that did this, and we talked about everything from the school levy to speeding to development. Other times there was no one there, and it was just me with a trash picker and a garbage bag. Either way, I get my steps in for the day, and I get to clean up a little bit of the community. But that's going to be at Roundelay and Pryor tonight at 6:30. We have 4 other ones. This weekend I'll be at Kingsley, starting off at Quarry Park, and then we've got Tomahawk Trail, Woolham, and Broadwin over the next couple of weeks. If I continue to get good turnout, then we'll do this again starting in the spring when the weather warms back up again. We do have a road update. Wagner Road did have a minor gas leak today. Verizon was getting ready to do some underground things, and they apparently mismeasured something or another, and so they nicked a gas line. It's open now, we're all good. Not the gas line, the road, so we're good there. But we are looking forward to the work that will be done on the bridge probably in the next couple of weeks. Columbia Gas is on pace, and AEP has actually vacated the areas, and they're now moving down Wagner Road, which is good. The other thing I wanted to mention is CODA has a levy that we all have talked about. We're going to have a representative from CODA here in 2 weeks. We're going to have a representative here from CODA in 2 weeks to answer questions, but they have a open house on October 9th at the Livingston campus in Reynoldsburg, so that'll be there, and you can get very direct answers from them. I can give you pretty decent information, but if you've got real technical specific questions, that's where CODA is going to go ahead. So we'll get that information out there more so. We did have a question earlier about the flooding town hall. It was good. It was well attended. We probably had 45, 50 people there. And it was really good to see some of the modeling that the organization has done, working in conjunction with FEMA and the Army Corps of Engineers to kind of figure out, okay, when it rains, what level of rain comes that gets this much flooding or that much flooding. Our next meeting after the data collection is there is going to be in February of 2025, where this is the important one that everybody really wants to go to. This is where we're going to talk about solutions. One thing that came up in this one is some of the drainage areas. They had small drain inlets on the roads, so one thing would be simple enough to open those up. But then there are going to be some other solutions that are from the engineers as well. So we're looking forward to hearing about that. This past weekend, we had the Heroes for Heroes 5K. My wife and I have always participated as volunteers. I'm not running. No, I'm not running. But we did that. It was really fun at our Civic Park location. We had 109 participants this year in honor of 9/11 and those that sacrificed themselves. So it was a great time. You could not ask for better weather. For people who run, and again, I'm not that person, they said it was really comfortable because it was cool enough that it wasn't too hot, but it wasn't too cold to go ahead and get loose and things like that. Some cool events that are coming up. We've got September 21st, we have Pioneer Day. I know that's my assistant Jessica's favorite event. You get to take a trip back in time and get on, take events and things like that at the Livingston House from like the late 1800s. So there's going to be all sorts of different activities all the way across. People in period costumes and things like that. So that's always fun. We also have Adult Prom this weekend, which is at Eastside Brewing. Adult Prom is a fundraiser for our Parks and Rec program. So we are doing Adult Prom, and then the money is actually going to go to a scholarship fund for some of our kids that are of limited economic means, and this will help them allow to continue to partake in some of our activities throughout the year. It's at Eastside Brewing, which is just down the road from here, so you get a couple of nice beverages, and you get to enjoy Slab. They'll be there, which is our great barbecue restaurant that we've got here in Reynoldsburg. So that's always a lot of fun. So I hope you can join us for that one. I think you can get tickets at the door, but you can also register online. We also have Blues and Brews this Friday night, and I don't know if this is a good thing or a bad thing. If you register and go online and go to a Google document, if you're one of the first, is it 25? You have the opportunity to get your own harmonica. So if you want to find ways to annoy people that are all the way
a mini lesson.
And a mini lesson, there we go. Then this is your opportunity to go ahead and do that. So honestly, I would do it just to have fun. So every now and then, as we're walking through City Hall, I can bust out the harmonica. So I've been told I am not allowed to do that, but we'll see. We also have Constitution Day next week on the 17th, and that's going to be right here at City Hall. This is where we will have the Constitution, and we'll ring the bell at the exact moment the Constitution was finalized. And I will most likely be in period costume. I go with the whole Hamilton / Revolutionary War era thing, so that's going to be a lot of fun. Probably not going to go with the wig this year. The wig is just too much. You gotta have limits. We also have the Ohio Fire Marshal Festival this Saturday from 10 a.m. until I think 2 o'clock. You've got Touch a Truck, you've got canine training, food trucks, helicopter landings, bounce houses, face painting, all sorts of stuff. Again, the Fire Academy is located right here in Reynoldsburg, just past Taylor Road. On the east side of town, so I hope you can join us for that one. It's a lot of fun. Have you ever had the chance to do that?
I have not.
But you talk about all of the different fire trucks that are out there and all the cool things. I know kids are always enjoy that.
That's great.
We have National Voter Registration Day on Tuesday, September 17th. So if you have not yet registered to vote and you want to make it a big occasion, head out to the Reynoldsburg Library on the 17th from 3:30 to 6:30, and then you can go ahead and get yourself registered to vote and meet all of those specific deadlines. And then also we have Issue 1 Town Hall at the Columbus Library, that's downtown, for information for Issue 1, which is the gerrymandering issue. That's Thursday, October 10th from 7 to 8 p.m., which again is another one of those ballot initiatives. And then this weekend, a great fundraiser for Reynoldsburg Helping Hands, which is one of our food pantries, is doing a kind of a conjunction fundraiser with Big Sandy Superstore, where if you buy something from Big Sandy Superstore, a percentage of that will go to actually support Helping Hands, which is a good thing. My favorite thing is we got our Halloween party coming up on October 19th, and we're calling all dinosaurs. So if you are one of those people out there that has an inflatable dinosaur costume, we're calling for you to come. We're going to try and get a big thing in there because it's a little bit of our Jurassic Park theme this time around. So hopefully that'll be a good thing. We have a couple of cash drops. September 15th, we've got Special Olympics, and September 21st, we've got Reynoldsburg basketball. And then always, the Tomato Festival is always a good time, but next year is our 60th anniversary. So we got to kick it up a notch for next year. So if you want to participate in any kind of activities to kind of move that thing to that next level, stay tuned. We're going to have some meetings and things like that as well coming up. And we are also going to celebrate the United States USA 2050. We did pass a resolution on Monday that we're going to be one of those official cities to celebrate the 4th of July a little bit in a bigger measure all the way across. So before we wrap up, do we have any questions? Anything that popped on?
A couple things.
Good, because I was really going to get jealous if he got all the questions and I got nothing.
Someone would like to know how they can go about getting a few children at play signs.
That would be a good question. So reach out to us. Most of those things, depending on the neighborhoods, if it's an established neighborhood, it's a little bit easier to do so. If it's the new MI Homes neighborhood, they will not put them in until that neighborhood is done, just based on the construction traffic that's in there. But that is a good suggestion.
And they would like to know if we can increase traffic enforcement for the next 2 to 3 months, and they would like to see it continue into the next year. They're seeing a lot more drivers with road rage, complete blackout car windows, and license plate errors.
Yep, we are doing as best a job. We usually do traffic blitzes. Our staffing is not designed to do massive traffic enforcement on a consistent basis. We just don't have the officers to do that, and they can't be at every single intersection, but we do have those traffic blitzes, which is how we're able to get some of those things. The best thing I would suggest that if you notice traffic in your specific area that, again, like the traffic monitoring signs, if we have a data point where we know that every day between 4 p.m. and 5 p.m. the blue Civic with the tinted windows is driving through and it's always speeding, that helps us kind of narrow down and we can kind of go ahead and get some resources out there. It is the number one complaint that we get here at City Hall is speeding throughout and going along with the other stuff. I can't legislate or do anything about road rage because usually by the time that happens it's there, and I know this again is an issue that people typically when they see police officers they're not speeding at that point in time, so usually it has to be an enforced thing. We are out there as best as we can. So
that's all
right. Well, next week I have State Senator Herschel Craig will be joining us, and we're also going to have representatives from the Franklin County Board of Elections to talk about the election coming up, what kind of ID you need to have, what the process is going to be for early vote, and then probably, I guess, one of the most important things is they're going to try and recruit people for working on the polls. That's a huge thing. It's a long day. You're not getting rich off of doing that particular thing, but it's such a rewarding experience because you're legitimately there in the process for democracy. So
I think that's great. And civic engagement and that social connectivity you've been talking about, Mayor, all these activities and all this great, all the events.
Yeah.
This is public health, by the way,
Yes.
and this is great. And we actually support our staff to take the day off and work the polls and volunteer there. So that's a great opportunity to really be directly involved in the elections.
I mean, everybody says, every election is important, and every election is important. And it's not just your presidential elections, it's your local county elections, it's your city council, mayor, all of that. Every election is important because everybody contributes in some way, shape, or form. The presidential always gets the big press. That's always going to be the one that everybody pays attention to, but there's all sorts of other things all the way down, and I'm looking forward to hearing from them because they're the ones on the front lines, and I know that they're going to need some volunteers. So that's good. I didn't know that you guys encouraged people to work on those things. That's good.
And give my best to Senator Craig. He's a good friend of public health.
Yes, he is. Any other last second questions?
2. How does citizens propose change to city agendas? They would like more information on that.
I probably need more specific, like if they're looking for like council agenda or like objectives for the city to kind of go through. If it's something that you like, hey, I'd like the city to move in this direction on this topic or that topic, by all means, please set up a meeting with me. We can talk about it. If it's more council oriented, then you can meet with your either your ward representative or your at-large representative in there. But I would probably need a little bit more specific, like what they're talking about specifically as far as what the agenda would be. Because when I hear agenda, my mind automatically goes to like the item 1 on the agenda, item 2 on the agenda, that type of thing.
And then the next one is they would like to know if can I consider my comment a reach out for children at play signs on Briaro?
Right, yep, I know.
Please advise.
Yep, no, we can go ahead and talk about it, but again, at that point in time, there's a lot of issues to try and figure out putting one of those signs in there, depending on where things are located and the number of kids. Oh, that's what happens when I keep knocking the table into it. But no, that one I have heard before. So, all right, if there's nothing else,
that's all.
All right, well, thank you very much again, Joe. I appreciate it.
Good to see you.
Good to see you too. Next week we'll be here again. Stay safe, stay respectful, and as always, please put your shopping carts away. It is one of my big pet peeves. So, see you next week, everybody.